Well, first and foremost, Deran, thank you very much for having me here. You know that we have a long-standing collaboration with the Kluge Research Institute, a WHO collaborating center. And in fact, I'm happy that you are walking the talk through this major conference, doing it digital, which is part of the new world. And this brings me to the point that WHO has been advocating for many years to strategically invest into digital health and digital health systems, be it to help transforming health systems, boosting new models of service delivery, to educate the population on the role of digital health in prevention, care and monitoring. But you're absolutely right that this whole COVID-19 response has given a tremendous boost towards scaling up in digitalizing our health systems. And we have seen many great examples throughout the regions, going from teleworking towards, in fact, keeping patients and suspect cases out of the hospitals, because we know that inside the hospitals, sometimes the COVID-19 is an amplifier. But the key issue here is not to repeat the pitfalls from the past that we are aware about, mainly on the governance, the interoperability, the trust for digital health. These are key issues. And you're absolutely right that we had challenges to leverage the volume, but also the type of the data. So I would say that a lesson learned so far is that it's not only about digital health and the data as such, but the whole systems approach, what WHO has been advocating for time and again.
You've mentioned digital contact tracing utilities earlier, and I wonder if you could give us an overview of where Europe is in terms of the different solutions for digital contact tracing and your personal point of view on what is the potential of this technology for all of us in the overall context.
This, Ran, is probably one of the most frequently asked questions that I'm getting from the media, from the countries, and it's very topical. In fact, as of today, 27 out of 53 countries in the WHO European region have some kind of digital contact tracing solution, with 4 more lining up. And a lot of progress, but we have to be also, again, modest here, and we know that there is still no final, let's say, answer on the complete effectiveness. A number of issues come back, and no surprise. We know most of the issues. It has to do with ethics, with human rights, with privacy, and to one word. And you and me have been discussing this for many years, but it's really key again, it's the trust. And the trust issue is at the core of my vision, the European Programme of Work. Because what I would like to do with the vision for the next 5 years in the WHO European region is to help health authorities, to empower them, to help to answer to the legitimate concerns that people have toward their health authorities. And trust is what I call a biggie. And a key issue there is, I think, Ran, that we really have to come, and this is also something I have come to, let's say, to peace with myself, that there will always be a segment of the population which either is not able or not willing to share their private data with the health authorities. And let's not pinpoint and stigmatize those segments of the population, but design solutions and operational approaches which take into account those people. And if we do this in fact, I'm sitting, as you know, in Scandinavia. Scandinavia has a very strong partnership between the people who have, if you compare across the region, a very high level of trust towards their health authorities, whether it's on social distancing or digital contact tracing. So in that sense, we have to acknowledge this and work out a partnership between the health authorities, the medical, paramedical workforce, and the people.
This was, I think, a very wide-angled, advanced view of what is a truly multifaceted problem. Now, looking forward, what are some of the immediate and medium-term actions that governments and health authorities can take to accelerate the acceptance and the uptake of digital health in helping all of us to respond better to COVID-19? And we know there are very large differences in different countries in the region and in general in the world. What would your advice be to decision makers?
lot of people are still passing away due to COVID, but a whole group of people are suffering because they do not get the treatment for a whole lot of other pandemics. A pandemic of cardiovascular disease, a pandemic of diabetes, of cancer. So there is, I think, where digital health can really make a huge impact in terms of equity and population-based impact. On the COVID-19, everyone is focused on it. I'm less worried. I'm more worried, how do we leverage digital health to decrease and avoid excess mortality? For example, how can we increase access to mental health services? Mental health is a flagship for my vision, for my mandate for the next 5 years. And this was before the COVID, but we know that we as a society will have to live with huge impacts of mental health, including consequences of the lockdown, is number one. Number two, early warning signals for other infectious diseases. We may face a second wave in the fall when COVID will meet the flu, influenza-like viruses and pneumonia. But also, let's think of how to take advantage of digital health for vaccination records and reminders, because we know that vaccination works. Still a huge question mark about COVID vaccines, but we know that vaccines for seasonal flu work. So let's take advantage also to beef up health information and decrease, right, the, let's say, what I call infodemic, the misinformation. So I would say that is something that very quickly we can make a huge impact by decreasing mortality and boosting health. My biggest concern, Ran, and you know this because you know me quite well, that social justice has been the foundation of my entire career. As a health leader, I cannot and I will not allow that we are going to have another divide. We have a social divide, and we saw it in the COVID-19, that the vulnerable people were really, in fact, hit more than the general of the population, so we cannot afford another digital divide. And that's also a big concern of the UN Secretary General. So let's work together to really safeguard, because if it's one thing that the COVID-19 has learned me, it is that no one is safe until everyone is safe. You may be a country which is doing very well on the COVID-19, your neighbor is not there. Borders, we know, cannot be closed hermetically. No one is safe until everyone is safe. So let's see this, including with digital health, as a boost to international solidarity.
You know, the problem of disinformation is a huge one. And you know there is a serious problem when healthcare becomes politicized. And this is the case right now. And it brings a whole set of new challenges to everyone. Would you be able to share with us some thoughts about how this infodemic, as you called it, what will be your recipe and your involvement? Because, you know, WHO at the bottom line is the single most trusted entity everybody's looking up for to give them the right answers at the right time and to tell them how to differentiate between true and false. But you yourself, you have to deal with a deluge of data and science. And you as a decision maker and as a leader need to make calls very quickly. So maybe on a more personal note or an organizational note, could you tell us about how the WHO is tackling the infodemic and how you personally deal with it in your day-to-day life? Because, you know, the need to read all day long and to stay updated, it's something that is difficult for all of us. So how would you tackle this?
This is absolutely true, Ran. And we get many questions also from family members, right, who question. And let me start with one issue, that science is iterative. It makes evolution. And I think that in itself is very important to communicate to the people. And it's tough, no? Also, ambassadors ask me and they expect that we have all the answers. I mean, we have a virus here, 6 months, not old, 6 months young, which is completely new. So there are many unknowns, and we have to explain this so that people don't say WHO or science at large got it wrong again, whether it is on mask or how it is being transmitted. So I think a key issue there on what I learned, because I'm under, as you know, a waterfall the whole time, is don't be defensive. And sometimes it's difficult because we all face so many pressures and we're exhausted, but let's not be defensive, right? And learn from each other. This is very important. Meanwhile, some very quick ones is that we work as a one WHO with Facebook, with Google Alerts. So we have to work also with the social media. And many of the social media outlets are very keen to work with WHO to counter this infodemic. This is very important. And again, we have to be a little bit more savvy to work with the society at large and target different segments of the population with different messages. Because WHO used to have one size fits for all. You look at the website and that's it. We cannot do this any longer. And we feel this because we had before the COVID, for example, an anti-vaccination movement. Already now, people think vaccine is going to solve everything. First, we need equal access, but also, again, are the people of 40 years or 45 years going to be keen to be vaccinated? So we need to differentiate and target different segments of the population. But it's a big one. It's a huge one. And again, digital health can really help us. And WHO, and that's what I would like to do, to work with what they call champions. There are people in society that people listen to. My daughters are very polite to me, Ram, but they don't listen to me because I'm WHO, right? So, but if some stars or some sport champions are telling like this, they have a huge impact. So let's modernize and think a little bit afresh, right? To have those people who are good-willing, and there are many in the world, I see this, many people really want the best and to leave no one behind.
That was really brilliant. Really, I thank you very much for the time and also for the wonderful insights that you have shared with us. I'm sure many others will find this exceedingly helpful in making decisions in this hectic time. So thank you very much once again. It was a pleasure and a privilege.
With great pleasure, Ron. Great pleasure. I mean, you know, I follow your work very closely. And you know that when you go through this, I really would like us to sit together physically or virtually to scale up our collaboration. I think I'm a strong believer in what you're doing. And we also, as a country, Israel has a lot really to show. I would like to, let's say, to go into a new era of collaboration with Israel, really.